everyone. It's Dr. Abraham, and I'm here with Lindsay, and this is Rejan Med.
Welcome back, everyone. So today in our now this is our third podcast. We want to kind of go over some common questions that people have regarding regenerative medicine, and I guess the most common question is, what are the most common treatments or ailments that people come to you with to treat with using regenerative medicine?
So, some of the most common things that I see on a day to day include things like joint pain. Uh, we do a lot of we do a bunch of aesthetic medicine. We do hair loss treatments, sexual dysfunction. Those are the things I would say I see more on a day-to-day basis. So, as we've talked before, with regenerative medicine, it encompasses so many different fields and so many different therapies. Um, there's a lot of like very exciting research and advancements that are going on, uh, but it's still in its like baby stages in many fields. But I feel like things like joint pain, which is one of the things that we see a lot. So whether it's like things like knee pain, hip pain, elbow pain, shoulder pain, um, this is an area where regenerative medicine has made like significant advancement and actually plays like it can play a big a major role today. So that is definitely something that I deal with on a day-to-day basis. Um, Again, the aesthetic field is, I think, is another field where regenerative medicine has made major strides and can be very helpful and very powerful. So those are things that we see on a day-to-day basis. Yeah, those are places where we do things like PRP, cell therapy, um, to kind of try to address some of these issues.
Okay. And then what exactly is cell therapy?
Cell therapy is basically, as the name suggests, is using cells in therapy. So, and a little bit more, I guess, a more comprehensive definition would be it's like a branch of regenerative medicine where we're trying to use cells, and I guess I can get into a little bit more into that. But where we're using cells to help either rejuvenate tissue, to help optimize function, but to help us achieve whatever goal we're trying to achieve, and we're using cells. So examples would be things like stem cell. Another example would be things like PRP, which I just mentioned, where we use the body's platelet-rich plasma. There are, sometimes we use T cells, which are specific cells of your immune system. So you know, there are different types of cell therapies that exist. Some, again, are much more popular. Some are used more often. There are areas where it's still kind of we're still kind of in the beginning of the field, so there's more research needed. But that would be cell therapy. And there's a couple different ways to define it and kind of jump deeper into the subject, because with these definitions, it's not like there's a lot of overlap between cell therapy and regenerative medicine and other stuff. It's not like very well defined, so it's actually also one of the things where I feel like we're formulating the definition and rebuilding the definition as we go and as we discover more things and more ways to use our cells or sometimes other people's cells. So cell therapy, and you can cut me off and change the subject anytime if I start kind of like talking for too long. But one way to look at cell therapy is we look at like autologous versus allogenic cell therapy. And with autologous, we're talking about using somebody's own cells. So that's why it's autologous. It has the word auto in it, which means
From the same.
yes, it means self. I don't know if it's like Greek, or I think it's a Greek or
It's a
Roman or
Greek
something,
word.
but it is a word that
Greek
means,
word.
yeah, which is why we use things like uh, automobile, or which like self-driving, or autoimmune when we're talking about autoimmune disease. So that's an issue where somebody's own immune system is causing problems. It's attacking healthy cells, so we say they have an autoimmune disease. So that's the word auto. So when we were talking about autologous cells, we're talking about using somebody's own cells, whether it's their own stem cells, their own lymphocytes, their own PRP, versus when we talk about allogenic, we're talking about using somebody else's cell. But they have to be from the same species, so they have to be humans. Because there's also xenogenic, which is using cells from a different species, which is not something that we do yet. But who knows, in the future, it might be something like where you can take a frog or something and take their cells and transform it and make it like work for a human, to like remake your liver. We don't do that. But
We don't do any of that, but
that might be coming in the future. But allogenic is actually something that's commonly used, and it's there's a lot of interesting examples. Like, for example, if you want to give you an example with allogenic, like I think that's very interesting. But like people who have diabetes, which is a very common problem, specifically type 1 diabetes. So there's two types of diabetes 1, diabetes 2, and I don't want to go to in too much details because that's not what this podcast is about. But with type 1 diabetes, people they're not making enough insulin, which is the hormone that helps regulate sugar. So that's why you see people sometimes very young, they become diabetic. Their bodies are not making the insulin they need. And one type of treatment that can be done in some of these people is to transfer cells from a donor, pancreatic cells, specifically pancreatic cells, the cells that make diabetes, they make insulin. So you take these cells from a donor, and then you place them in the patient who has type 1 diabetes who doesn't have these cells, or who have these cells but they're not making insulin, and so that they can make their own insulin and pretty much like resolve the disease. So that would be, you can place that under the heading of cell therapy, and specifically it would be allogenic because you're getting it from a different person for the same species, but you're getting these cells that can make the insulin or whatever hormone you're looking for, and then you're placing it in the recipient body who didn't have these cells, or who didn't have a healthy version of these cells, and now they do, and they're better. And that would be also, I would say that would also fall under the umbrella of regenerative medicine in a way, because you're helping you're helping like restore some of their optimal health. So long explanation, sorry, but
no, but it's informative because a lot of people aren't really familiar with stem cells or PRP and like what exactly does that do, and like they hear that term thrown out a lot. And a lot of people are saying they're like doing cell therapy to treat different things, but they don't even know what that means. So it's important for people to see how the application can be used on different parts of the body, and on yourself and from outside forms.
And there's like obviously advantages and disadvantages to each type. So like if you can use your own cells many times, that would be like preferable in many situations, right? Because there's like less chance of your body rejecting these cells. But obviously, if like the example I just gave, where somebody doesn't have these cells, or they have these cells but they're not doing what they're supposed to do, then it wouldn't make sense to use their own cells. So you kind of go and find a donor and use their cells. And there's a lot of things that you would want to consider there, right? Because like in that specific case where you're using somebody else's pancreatic islet cells, you might have to put the recipient on immunosuppressant medications to make sure that, again, their body's not rejecting these cells, and the degree to which that treatment works. So it's not like a super easy thing to do, but again, that is an area where medicine is getting more advanced each day. So hopefully one day it becomes a very easy and accessible treatment to do, but at least the concept is there, and it's proven because there's already been clients who've been treated that way and are doing really well. So
yeah, we've had great response from utilizing the the PRP, and people have, you know, a few injections and they're starting to get that movement back. They're starting to like have that ease of pain, and it's because their cells are literally regenerating and creating new cells, healthy cells.
Yeah.
All right, well, that wraps up today's episode of our podcast, and I guess tune in for next week for another interesting topic.
Yeah.
With Dr. A.I.
Yeah, thank you guys for joining us. Today's, I guess, is a bit of a shorter episode, but let us know what you want us to talk about, and we'll see you next week.
Send us some topic ideas in the comments.
For sure.
And see what questions we can answer for you.
Awesome. Have a great, week.
We'll see you next time.